at the clinic because we have the stocks and we have everything set up just right. But we can also do this in the field, in a barn situation, in like a box stall, which pretty well. Before starting with an oral exam, I'm just going to do an external exam of her head and make sure everything looks normal, that there's good symmetry between the two sides of her face, and I don't see anything structurally wrong with her head. And then I also take a look at her lips and the front of her mouth, again looking for any injuries or scar tissue or tumors. And then we use this full mouth speculum. So we take their halters off and put this on these incisor plates. These fit right on the incisor teeth, and then we can ratchet the mouth open. So I just place this on her incisor teeth like so, and then we can ratchet the mouth open. Like so. And that's going to give me the ability to look in her mouth and examine her mouth thoroughly, as well as get my hands in there safely. And then we use this dental halter. It just has this plastic tubing on it. And then on the nose band we have this rope that's strung up so that we can hold her head up. Because she's so sleepy, she wants to just let her head stack. This holds it up at the place we can work the best. Then we use this bright headlamp so we can illuminate inside the oral cavity, and we can take a look and see what's going on. And we can see some abrasions or ulcerations on her cheeks from these sharp rims here, and we're going to file those down. And I'm going to start with that, and then we can talk some more later. Corner of the upper teeth where those sharp rims were poking into her cheek, and made that nice and smooth for her. One of the things we look for when we're looking at the teeth is how well are they aligned and how evenly are they worn. And if there's uneven wear, then we're going to try to help correct that and lower the high teeth. And she's got pretty good alignment, and her teeth look quite good for her age. For the lower cheek teeth, we actually do the grinding on the inside upper edge of the lower cheek teeth. It's on the lower teeth. The sharp rims are on the tongue side, as you can see in the left lower row of cheek teeth that we have right here. And so I'm just going to go ahead and start grinding that. And then we use this little instrument here. It's just a cheek retractor. Helps pull the cheek out of the way so that I can see better. Sharp rims that were on the upper corner of the tongue side of the lower cheek teeth. And also she had a little bit of a hook on the very last cheek tooth toward the back that I ground down. I think you can probably notice the difference if you look at the before and the after. Okay. One of our concerns is our own health. So that starts with the containment and proper sedation of the horse so that everything's safer, but it's also the things that we wear. So we wear the mask so that we're not inhaling all of that fine dust, which if you're doing a lot of this, it's going to get down into your lungs and cause problems. And then of course the ear protection for protecting our ears, because the grinder's pretty loud. She's been a really good patient. Not all of them are. But what makes her a good patient is she stays pretty still, and during the process she really doesn't fight much. She's not moving her tongue around, and she's really pretty cooperative. So again, when we're doing teeth, we're filing down these sharp rims. We're also going to file down the high areas. But on her, because of her age, I'm not going to make the high teeth as short as the shortest teeth, because that would be too much. And that's where experience comes in doing this, so that you're not doing too much. And it's important for the teeth to be the same height, because then their chewing mechanism works more effectively. And she jumped because I moved my hand too quickly, so sorry about that. With this kind of arrangement is we can use this mirror so we can look at the chewing surfaces of the teeth and evaluate them. And she does have some decay, but nothing that is causing any tooth infection. Just some superficial decay on the chewing surfaces of the upper teeth. Okay. So we're going to just take the speculum off. And you can see she's not all that sleepy, and she's being very cooperative. Other than the one time I scared her. I'm going to take the mouth speculum off, and we're going to glance and take a look at her incisor teeth and make sure that they look healthy. Most of the time we don't have much to do with the incisor teeth. The biggest thing is if they're wearing unevenly. Again, we'll try to balance them. Sometimes they get tartar at the base of the tooth. We'll take advantage of having them sedated and scrape this off. Her upper and lower incisors come together really nicely. Where they come together forms a nice straight line, and that's what we want to see. If she had a tilt or a smile or a frown shape to how her teeth came together, we would make some correction there. Usually the gums will bleed a lot. It's pretty common for them to bleed a little bit after we scrape off this tartar. On the male horses, geldings and stallions, they all have large canines, and for some reason the lower canine gets a lot of tartar. Okay, I think that's about